Welcome to Samba Samba. Enjoy the video.
You start by making sure the device is charged and your face is clean. Power it on and select a gentle mode. This gives you baseline pressure and heat so you avoid sudden intensity. Once done, position the mask over your eyes, centering the nose bridge, and tighten straps until it sits snugly, but not tight. You should feel light contact evenly across the eye area. This ensures the massage motors and heat plates make uniform contact for effective results. You now select the massage mode and tailor settings to your needs because different modes target different tissues. Start with low-intensity air pressure and low heat to let your eyes adapt, then increase vibration or pressure gradually if you feel comfortable. Make sure the timer is set to 10-15 minutes, as longer sessions can overheat sensitive skin. Once adjusted, relax and breathe slowly. The gradual ramp-up and even pulses promote circulation and reduce tension without causing strain. You finish by powering off and allowing the device to cool before removing it. Wipe the contact areas with a soft, damp cloth to keep sensors and pads clean. Once removed, perform gentle blinking and short eye breaks to normalize moisture and circulation. If you experience discomfort, stop immediately, loosen the straps, lower intensity, or skip heat. This usually resolves pressure or sensitivity issues. If problems persist, redness, pain, or vision changes, contact the manufacturer or a healthcare professional for guidance.
Thanks for watching. Consider subscribing if we helped you.